This is going to be the first in a series of videos on Louisiana's Governor Bobby Jindal. Since the 2008 losses by the Republican Party, many are looking to new leadership within the party, and one of the biggest names being tossed around is Louisiana's governor. Unfortunately, the press release of Bobby Jindal has been very lackluster during his political career. News reports about Bobby Jindal have often read like campaign press releases. Because of this, in part, Jindal cruised to victory in all of his elections to date. And while I fully expect the national media to eventually grasp their duty to inform and really do some fact-checking if Jindal becomes a serious contender, I see no reason why we can't start now. The first topic I want to give you is a topic that brought Jindal into the limelight, and that is the issue of health care. And one of the most notable facts that people will often bring up is that as Louisiana's Department of Health head, Bobby Jindal eliminated a deficit of $400 million and created a surplus of $200 million. Now, if Jindal was working for a large for-profit corporation, he will be viewed as a hero, and rightfully so. However, Jindal was not working for a for-profit corporation. He was working for the department that was responsible for providing health care for people who cannot afford it for themselves. It was the department responsible for providing Medicaid assistance to those who need it the most. As part of his cuts, Bobby Jindal closed down rural clinics that people would go to in order to get needed medical care. So let me ask you this question. Why did Bobby Jindal continue to close down rural clinics after he eliminated the deficit? Why was there a need to run up a multi-million-dollar surplus when those funds could have been spent keeping those rural clinics open? Could it be that Bobby Jindal only looked at the numbers when making those cuts and not at the effects on the people by those cuts? Could it be that Bobby Jindal was just looking to pad his record with a nice figure of a $200 million surplus in order to advance his political career? Could it be both? I'll let you decide on that one. Now, what effect did Jindal's cuts have on Louisiana's healthcare system? Well, Bobby Jindal served as head of the Louisiana Department of Health from 1996 to 1998. According to a report on Louisiana's own health website, there was a 2000 report that I linked to in this description of the video, Louisiana ranked 48th in healthcare for 1997, 49th in 1998, and dead last in 1999. So during Jindal's tenure and 1 year beyond, Louisiana's healthcare rankings dropped to dead last. One of the reasons listed? Access to healthcare. What did Bobby Jindal do during his tenure? He closed down the rural clinics, eliminating access to healthcare. According to the study, lack of access to appropriate care in their communities is resulting in many ill persons becoming patients at state hospitals. These same individuals could be better served if there are more outpatient primary care facilities available and accessible in their own areas. So it seems to me that Bobby Jindal, by closing rural health clinics, did the exact opposite of what was needed to help save the healthcare system. Yet he is held up as some sort of hero by his supporters because he was able to save money. I used to work in a hospital. I worked with doctors and nurses who witnessed the changes to Louisiana's healthcare system firsthand. When asked if the cuts Jindal made as head of the Louisiana Department of Health made it harder for them to provide the needed health care to those in the system, their response was an overwhelming yes. Jindal has also had some other ideas that seem to be counterintuitive when it comes to health care. For example, in his campaign for Congress in 2004, Bobby Jindal suggested that we implement a system of co-payments in Medicaid. Yes, you heard that right. People who cannot afford their own health care would be asked to pony up cash before they could get treatment. Does that make sense to you? Makes absolutely no sense to me. Finally, in an interesting twist, one of Jindal's campaign contributors made a commercial for his governor's campaign where he stated,
"Being a doctor in a rural parish, I see so many people who depend on Medicaid.
Now, is it just me? Or does Dr. Abraham have a vested interest in making sure that rural clinics do not open up in his area of town or his area of the state? If they don't open up, then people would have to spend their government Medicaid money at his clinic. And I'm sure that Dr. Abraham currently makes more than the maximum campaign contribution that he made to Jindal's governor's campaign from the Medicare patients that he received in his office. I guess it pays to be a Bobby Jindal campaign contributor, but I'll get to more about that in some of my later videos. Now, you don't have to take my word for it. Go research it for yourself. I have provided you with some links to help you on your way, but I found all this information all by myself. And I think at the end of the day, most reasonable people will realize that Jindal is not the healthcare expert that the right wing would lead you to believe. But basically, it is up to you to make that call for yourself.